Hi, Melissa, internationally certified infant and toddler sleep consultant here and founder of Baby Sleep Code. And I have invited Susie from Susie Prout Lactation to join me and answer all of your breastfeeding and bottle feeding questions. So I've got a whole bunch of questions that everyone sent in through Instagram. But before we get into it, did you want to just introduce yourself and talk to us about what you do and how you can help people?
Yeah, absolutely. So my name's Susie Prout. I'm a registered midwife and an International Board Certified Lactation consultant. Australian, but we're in Bali. That's where we live. So I do everything online, and I have online programs and online memberships for breastfeeding, bottle feeding, and bottle refusal.
And obviously with World Breastfeeding Week last week,
Yeah.
it's still very timely. So the first question I have been sent in is what to do when your baby takes a bottle but not formula.
So if your baby won't take the formula, but they're happy to take the breast milk, you can do a couple of things that you can try a few different formulas. So every formula tastes different. And there's no
smells so bad as well. I've
noticed. Certainly the ones that are allergy resistant or the pro-allergy ones, they do smell not great. And some babies prefer different ones. So rather than buying a big tub of formula, which is $40, and then you use, baby refuses it, and then you've wasted a whole tin, you can buy the little sachets, the single-use sachets at the pharmacy or just in Coles or something, and you can try all different types and see if your baby likes them. The other thing you can do is you can make up a formula bottle with water as it's supposed to be on the back of the tin. So you've got your formula bottle, that's completely right, and you've got your breast milk, and then you can pour a bit of breast milk in that to then disguise the taste of the formula. I wouldn't recommend doing that all the time, then that would be a last resort. But once baby has had the taste of breast milk and formula mixed, then sometimes you can then next time remove the breast milk and just go with the formula. But really, if your baby is not liking the formula, there will be a formula that they like. You just have to, maybe you should try the formula or some different ones. Yeah.
Okay, makes sense.
Yeah.
So this one is best remedy for clogged milk ducts.
Yes. And so what happens is you get a lump, a clogged duct. Sometimes you can get engorgement with that as well, because you may have that because your baby is not feeding effectively of that side, or baby hasn't fed well overnight, for example, and you wake up and you've got this very sore boob and it's really lumpy. Sometimes clogged ducts, blocked ducts, can lead to mastitis, which is an infection of the breast tissue, and other times not. The best thing that you can do is to breastfeed your baby really well on that side. And if your baby hasn't breastfed well on that side and the breast is not empty, then you can put the pump on after a breastfeed to completely drain the breast. And what you might want to do also on that side is to put some warmth. So you've put some like a warm pack on your breast, then breastfeed, then pump, and then you can put a cold pack on to stop the inflammation. And we don't recommend anymore. We used to recommend, but there's new mastitis guidelines out now, recommend vibration or lots of heavy prodding and poking. What we know now with that is it just causes more inflammation in the breast, and that's what we don't want. And if it doesn't go away in, say, 48 hours, and you can go and maybe go and see your GP, because if you have a blocked duct that is not moving and it's not getting any better, that's when it can actually be mastitis. And mastitis, you may feel redness around the area, you may feel pain around the area, and you may start to feel unwell, like you're getting the flu with a bit of a fever. And so then seeing your GP so they can work out if they need to give you antibiotics for that as well.
So another one is, how many bottles should I expect to feed baby after 12 months?
Like the amounts vary so much between baby to baby, because some babies will have no bottles after 12 months and they'll be really good on having their meals, their snacks, their water, and making sure they have enough dairy. So that might be cow's milk in a cup or a straw cup, a sippy cup. It might be that they're not really having cow's milk, but they're having enough dairy, like yogurts and cheeses and everything, and then they're having enough water to drink. So then some babies are not having any bottles. Some babies at 12 months are still having bottles, I would say, maybe when they wake up in the morning, before they go for their nap. If they're having 2 naps still at 12 months, it'll be the 2 naps before or after, depending on what the mum does. And then maybe at bedtime, that's 4 bottles. And then some babies will still be having a bottle in the night. So that could be up to 5 bottles, and that's fine. 5 bottles is fine, but it's only fine if it's not affecting solids, because by 12 months, we're now looking at solids as the most important form of nutrition. But if you've got a baby on heaps of bottles, or a baby who's breastfeeding 10 times a day, if that's affecting their solid intake and they're not progressing really well on solids because all they want is milk, then that's when we have to think, okay, what's going on here? So you don't have to have any after 12 months if they've had enough water and solids and dairy, or you can have heaps as long as it's not affecting their solids.
Yeah, and that's very similar to kind of what we advise as well. Obviously, we get a lot of clients who are, still either bottle feeding or breastfeeding to sleep, and now they're kind of ready to, or keen to move away from that. And what we do see is, obviously, if they are having, a bottle, before every nap, before bedtime, and then in the night, then often naturally they're not that hungry, during the day to have anything else.
Yeah.
Other thing actually is interesting though, is that if there is too much dairy, there can often, and then lower solids, obviously they can actually be low in iron, which
yes, absolutely. And there can also be constipation as well if there's a lot of dairy and not enough solids.
Okay.
As much as we think that dairy is not going to cause constipation, if you haven't got the iron and you haven't got the protein in your diet as well, it can actually throw off as constipation, not in the first 12 months, but as toddlers.
Okay, so this is another good one. So I'm having twins in a week. What is the best way to breastfeed them?
Oh gosh. Let's see, where do we start? Firstly, it's absolutely achievable to breastfeed twins. So a lot of people will be pregnant with twins and think, I can't breastfeed because I'm having 2 babies. So we've got to remember that our breasts are making enough milk for both babies, because our breasts work on supply and demand. So the more that we stimulate our breasts and the more that a baby sucks on them, the right amount of milk will be made for those babies. So if you're stimulating twice, you will make twice as much as milk as if you were having a singleton. So that's the first thing. But the second thing is that it's a lot of work to breastfeed twins. If you can see a lactation consultant, an IBCLC in the last couple of weeks of your pregnancy, and then you've got that lady to then see in the first few weeks of having your babies, because you're going to need an individual plan. So you're going to need a plan to be able to get those babies to feed at the same time, because if you are feeding both babies willy-nilly, then it really doesn't give you much time to do anything else. If we know that a newborn has an awake time of an hour the most, and then we're doing 2 lots of feeds and 2 lots of changes. So the mums that I've worked with that have found it okay is that they've been able to get their babies to feed together. And to do that, it's tricky, it's like you need a few more hands. And so to get someone to help you with positioning and attachment is really great. And then you may also, some mums of twins will breastfeed one baby and pump the other side, and give that baby a bottle. And then the next feed they'll swap around, and the baby that had the breast will have the bottle, and vice versa. So there's certainly so many ways to do it. But at the same time, you don't have to. If you're finding it a bit too much, it's okay to also be like, I'm actually going to do expressing, I'm going to do half mix, I'm going to go to formula. So the best advice is to have an IBCLC in your corner in the first few weeks, certainly even before you've had your babies, to make a plan for you so you don't feel completely overwhelmed.
And this just made me think of another question as well. Obviously, like, in the beginning, and it's certainly in those early days, you kind of demand feed. But obviously, if there's 2 of them, are they going to be hungry at different times? And then do you still try and encourage them both to feed at the same time?
Ideally, when one baby wants a feed, the other one has a feed too. And then so the first baby that demands, the other baby just gets on
gets a feed too, yeah.
And then that means you can then put them both down to sleep. So they can try and have the same sleeps as well. So by just, you know, bringing them all in together and doing it like that, rather than like, oh, that's one's woken at 10:50, that's woken at 11:20. It's just wild. So you've got to just try and bring them in together.
And even, I mean, we don't usually work with clients one-to-one until, you know, around that 4-month and on age.
Yeah.
But when we do work with twins, that's one of the advice that we do, particularly overnight, because obviously at that age, they might be waking up, you know, eventually as they start working with us, like once or twice a night. But we always say, whoever wakes up first, you have to wake the other baby.
Yeah, you've just got to do it.
Because otherwise, like, even if they're only feeding, you know, at 4 months twice in the night, and you've got 2 of them, you're up actually all night, you know.
Yeah, it's impossible. It's not sustainable. Yeah.
Can a 6-month-old who doesn't take a bottle or a sippy cup and only breastfeeds still be trained to take one, I guess?
Yeah, absolutely. So most babies will refuse a bottle if they haven't had a bottle within the first 6 to 8 weeks of their life, because when you have a 6 to 8 week old, so if your baby is before 6 or 8 weeks, they have an involuntary sucking reflex. You put something in their mouth, they will suck on it. When you get to 6 to 8 weeks, sucking becomes voluntary. They have to choose to suck. And so if you teach your baby to take a bottle in the first 6 to 8 weeks, then they will do it because they just have to suck. But if you haven't done that, or if you've given baby a few bottles and then you've left it for a month or two and now you're trying, most babies will then refuse the bottle. So what you're explaining, this mum that's explaining of a 6-month-old, it's very, very common and normal and expected. Yes, babies can absolutely take a bottle. It can be a bit of a process, and I do have a bottle refusal program that a lot of my ladies will go into, because it's not as simple as just buying the right bottle. There's no bottle on the market that replicates breastfeeding. There's lots of marketing that says it does. So many bottles will say, this is for a breastfed baby, this is anti-colic, anti-wind, all the things. There's no evidence that that is actually true. We can never find any studies from these claims. And so it's not about going out and spending $300 on 20 different bottles. The more overwhelmed your baby is with different bottles, the less likely they are to take a bottle. So just stick with 2. Lots of playing, lots of playing without any milk in the teat, getting the baby not scared of the bottle. You put something in front of a baby's mouth that they don't understand what it is and they're scared of, they're not going to suck, never going to suck. So it's all about taking that away. As the first step is to make them not scared. And then the second step is getting them drinking. Yeah, it's a lot for a lot of mums, and some babies will never take a bottle. Most will, with repeated exposure to it. And then certainly with my bottle refusal program, we give you a step-by-step program that you just follow the steps along to get them to take it.
Yeah, and my second, Ella, who is now 15 months, she never took a bottle. And we actually tried from, you know, quite young, like under that 6 weeks mark. But she was she had cow milk protein intolerance and silent reflux and all that stuff. So she just wouldn't even have a bite of it.
Yeah, it's really hard.
And then even as she was kind of getting a little bit older, I did that thing where I bought every single bottle, you know, like a million different types, tried every single one. She would never latch, but she never liked like a dummy or anything either, like just never. Never understood what it was for. And in the beginning it was quite hard because, like, you know, you have to be you have to be near them all the time whenever they, you know, need a feed. Like
overwhelming. Especially if you need to go back to work. Or
I think about that a lot, like in the US, because obviously a lot of our clients are from the US, and you know, a lot of them have to go back to work, you know, 3 months in or something.
Yes, really close. Yeah, exactly.
And then also you would assume that's probably why, you know, breastfeeding rates over there are lower than, you know, say in Australia.
Absolutely. Because they have a big drop at 12 weeks, which is when they go back to work.
Oh, there you go. Wow.
Yeah. Where we are more likely, we kind of drop more at the 6-month mark.
Another question. So nipple refusal after newborn needed formula top-ups and would like to phase out nipple shields.
So firstly, nipple shields, you don't have to take out the nipple shield if you don't want to, if your baby doesn't want you to. Some mums will use a nipple shield all through their breastfeeding journey. We just have to look at milk supply. The only risk of nipple shield, there's only one risk, and that is lower milk supply, because when your baby attaches to a shield, they don't stimulate the breast as if they were without the shield, because there's something there. So the breast is not stimulated as much. If a breast is not stimulated as much as without a shield, you're going to make less milk. And over time, and it's only a small difference in stimulation, but over time, that builds up to being a lower milk supply. Some mums will have that issue, some mums won't. So certainly in the early days, in the first 3 months of breastfeeding, if you are using nipple shields, you need to have more regular weights done, and also potentially a couple of expressing sessions through the day to completely drain your breasts, because sometimes with a nipple shield, we aren't able to completely drain the breast. And if we're not able to completely drain the breast, our body doesn't send messages to our brain to say, make more milk, it's empty, make more milk. So if we haven't got when you've got a full breast, the messages to our body are sent to say it's full, stop making milk. Milk is only made on an empty breast. And so we have to empty those breasts to make more milk. So that's the only risk of nipple shields. If you've got past 3 months and you're using nipple shields and everything has been fine, then there is no risk after that. So that's the first thing. The second thing with nipple shields is to get rid of them. Really, the only thing we can do is, there's no tricks, so it's just trying every day at most feeds. You can put your baby on to the nipple shield once the milk is flowing through the shields, because we want milk flowing for baby to be able to stay on. Once the milk is flowing, take the nipple shield off and put baby back on, and see if you can get baby on that way. If you're effectively able to get baby onto the naked breast with a letdown happening of milk, then that's your success. And then what you may need to do is to hand express to get the milk and letdown flowing, and then put baby on. So there's milk in the first time, the first suck that they've had, there's milk there, and then they'll keep on going. But really, it's just trial and error. And if you have a very flat nipple or a very inverted nipple, it might actually be that your baby uses a nipple shield their whole breastfeeding journey.
Encourage my distracted 8-month-old to breastfeed?
Yes, right. So this is also a very big question. I do have it's called The Distracted Baby, a masterclass you can grab on my website. However, in general, babies that are over 4 or 5 months or so, lots of these babies don't like to feed all willy-nilly during the day. They like to know what's going on. They need a plan, and not a routine and a timed routine, but certainly a what's happening next routine. So what you need to do is you need to have a pre-feed routine. So baby can't be playing, crawling around on the floor, and then you pick up baby and you have a feed in the middle of awake time. It's like babies like to compartmentalize their lives, and they can compartmentalize feeding, sleep, and play. And if we try and mix all that around, these babies are not going to be happy. So if you wanted to feed, play, sleep type of routine, then you would be feeding your baby after a nap, in the nursery, still in the dark, still in their sleep suit, and all of that to stop the issue with them not wanting to feed when they're awake. Not feeding them out in the lounge, feeding them in their specific feeding area. And by pre-feed routine, so for example, if you were having a baby who was feeding more towards sleep time, if that's what you did, then you would actually be like, right, pick the baby up from the floor, and you'd say the same thing. It's feed time now, whatever you say. You'd walk them the same way. You'd turn off the light together. You'd read the same book. Everything's a routine, and then you would feed them. So they know what's going on next. If we have a distracted feeder, there's no ways you can feed them just out in the lounge at any time of day, in the car, whatever. It's going to have to be in a routine. And certainly in my masterclass, I give you a routine to follow to get through that. But it's very common, and we've just got to remember that our babies don't like to change things up as much as we think that they are fine with that. If they're in play mode, they're not going to lie down and stop playing and feed for 10 minutes when they're in play mode. So yeah.
No, I love that. And you kind of mentioned sleep there as well, and it's exactly the same with sleep. Like babies kind of learn from the world around them based on those patterns and those routines and rituals. And same with sleep, we always encourage, like, you know, everyone always knows about a bedtime routine, but we always talk about, you know, sleep having a little mini set of steps that say, hey, we're about to have sleep. You know, whether you're settling to sleep, you know, holding them even, it's still good to have that, you know, lights off, white noise, because it just gets so much easier, because they know exactly what to expect, and they're like, okay, fine, you know, I know what's going on. Let's do this.
Absolutely. Yeah.
It's interesting to know that that's the same with feeding as well.
Very, very similar. Yes, absolutely. Yeah.
And I guess it's the same, obviously, with solids, you know, making sure they're sitting in a high chair, and, you know, you have those same rituals where you all eat together. So
yeah, that's very true. Yeah.
Similar. Okay, so obviously we're running out of time, but I think the last question I'll ask, and it's actually very close to home as well, because this happened to me to my first. So she hasn't said what age again, but is there any way to go back to breastfeeding once bottle preference sets in?
Right. Yeah. Unfortunately, quite tricky. You'd firstly wanting to make sure you have a great milk supply. We can't expect a baby who's had a stable amount of flow from the bottle. As soon as they suck on that bottle, there's milk there for them to go onto a breast that they have to work for. They're never going to suck on a breast they have to work for milk. And even with breastfeeding, even if you've got a great milk supply, your baby has to suck for about 60 seconds before the letdown happens. So you would be wanting to stimulate the breast for a letdown to happen, and then putting your baby on. Lots of skin to skin time, lots of unrestricted time at the breast. The best chance you would have is not during the day. I don't think it would work. It would be more in the night when your baby is sleepy, stimulates the milk is flowing, and then put baby on. Some mums have had success with using a nipple shield, because that's more similar to a bottle. So you would be able to breastfeed with a nipple shield, and then see how that goes. When I had my first, he got a strong bottle preference when I went back to work at 9 months, and yeah, I didn't succeed. We stopped feeding about 10 months or so, because the thing is they don't want to feed at the breast. They don't want to do it. So it's like, what are we doing this for? Are we doing this for ourselves, or are we doing this for our baby? Are we going to cause a screaming match and a fight, and then there's not enough milk there and everything? Where you can certainly express and give your baby the milk in the bottle. And I know I felt terrible about it at the time. And it makes us feel like, why they were so loved it, now they don't. But when you take a step back and you're like, what are we doing this for? Then it kind of makes more sense. Yeah.
I had the exact same thing, but my baby was newborn, and I had to top up with breast milk in a bottle. And the worst thing was I never learned anything about pace bottle feeding. And like you said, you know, it's really hard work for them to get that let down, you know, when breastfeeding. And with bottles, it's not. But for whoever asked that question, I did have success at around 9 weeks. So it literally took me 9 weeks, and I was very ready to give up. The key things, for me, everything you said, keeping up my milk supply. I had like a hospital grade pump to make sure I had heaps of milk supply. Lots of practice getting, you know, milk flow happening before trying to pop him on. And then no pressure around feeds. Like, it was bath time, 2 hours together, sleepy feeds, all of that. And then also, I think, like you said, giving yourself, you know, knowing that it's totally okay, like sit there and think about, you know, is it worth match and stress and blah, blah, blah. And, you know, and if you need to swap to formula as well, because that was the thing, is I didn't want to have to pump bottle feed.
Yeah, it's a lot. You
know, and if you need to swap to formula,
so be it. Exactly.
Okay. Well, thank you so much for joining me and answering everyone's questions.
Oh, my pleasure. That's great.
And before we head off, do you want to just say, I guess, your website and how people can reach out to you if they do have any other questions?
Yeah. So you can see me on Instagram on Susie Prout Lactation. Otherwise, my website, susieproutlactation.com. And you can, through there, you can purchase my breastfeeding membership, preparing to breastfeed classes, some bottle refusal things, distracted babies. I have lots of different classes you can buy, one-to-one consults, and or just come and see me on Instagram. I do lots of tips and tricks there as well.
Amazing. Well, thank you so much.
Pleasure.
Hopefully we'll have to do this again.
Absolutely. Yeah, definitely.